Hey everybody, what's going on? Dr. Wenzel with Brentwood MD. I wanted to create this three-part series all about executive level physicals. In this video, video one, I'm going to attempt to give you some things to think about to reframe the way you're looking at and considering both the value and worth and importance of an annual physical. I think for most people, when they hear this term executive physical, I know it's one of the most common questions I get is, Dr. Wenzel, what's an executive physical? What makes that an executive physical versus a typical annual physical? And I think, other than a fancy name, I think there is a completely different framework with which you would approach and pursue and walk through an executive level physical as opposed to a typical annual physical. Typical annual physicals, on this end of the spectrum, they really vary widely. I mean, it depends on the provider, it depends on the marketplace that you're in. There are some places where the typical annual physical is great. It's more than sufficient and certainly far superior than if you were in a non-ideal situation with a non-ideal provider in a non-ideal market where you just don't have access to it. So there's a huge variability with the quality and value and, or at least perceived value, and the overall experience from the patient's perspective on how good that physical is. I also think that one of the fundamental issues with the typical physical is that, and this doesn't make it good or bad or right or wrong, it just is. It's based on population health. So all of the recommendations, all of the policies, procedures, they're all based on what's best for the population. And there really is rarely the opportunity for health of one. And so as long as you're normal and you fall into these population-based norms or population-based guidelines, you move on down the road, and that may be okay. But nonetheless, it's population health-based. The other thing is it really favors younger and more healthy people, and it's just the way that it is because it's very volume driven. Most providers, I think on the light side, are seeing 20 a day. I have some friends of mine who are seeing high 40s to 50 patients a day, and they have to because that's just the way the model is working. You have to move quickly, and so that leads to the last point. These exams are really optimized for speed and volume. Again, it doesn't make them good or bad, it is what it is. And this is why you go in and it happens very fast. And if you have nothing wrong, that might be the right situation for you. When we look at an executive level annual exam, they're fundamentally different. They are optimized for the individual. I do executive level physicals for all of my patients, no matter what program they come in. I don't do population health. I do health one by one by one by one. So philosophically, I can't do a typical exam because I'm not optimized for speed and volume. I'm optimized more for the individual, and I'm results driven. In other words, why are we doing what we're doing? I can't manage what I don't measure. I try to measure only the things that are most important and that will ultimately change what I do or don't do, or what we do or don't do together as a team. And they tend to be, because they're not driven by volume, very strategic. And again, this isn't for everybody, and not everybody needs to have tons of strategy around their health, specifically younger, healthier people. But as we get a little bit older, we get a little bit busier, we have some things on the horizon that we're concerned about, we have some family history, some things. We need an element of strategic planning in our health plan that you don't always get with a typical annual physical. So when we reframe the way we think about the annual physical, I would guess, based on what people are telling me for years, is that most high-performing, high-achieving individuals either don't go to the physician annually because of a lot of these variables. I hear things like, just feels generic, it's inefficient, it wastes my time, I wait 6 weeks for an appointment that's 2 hours late and I get 9 minutes of the back of somebody's head. And then 2 weeks later, I get a phone call from somebody that says everything is normal. There's no opportunity for strategic planning, no insight, very limited wisdom and insight gathered from the visit. So they're deemed as kind of a waste of time. And so you're either doing it and experiencing that, or you're not getting your annual physical because of the perceived inefficiency and perceived lack of value in the traditional annual physical. So one of the things I want to hope to give you today is just some basic three-step framework to rethink about the value and purpose of an annual physical exam. Number one, what are your goals? It really depends on what your goals are. I have no idea what your goals are, but you probably do. And even if you don't, all the more reason you probably need a health advocate, a trusted advisor to come in alongside of you and help you identify these goals. But what are your goals? I mean specifically. And not only specifically what are your goals, why are these your goals? Why are they very important for you? Why is it important for you to lose 30 pounds of fat? What are the specifics? Get very connected to your reasons why these goals are very important to you. Where are you in the journey? I mean, you have a goal of 50 pounds of weight loss, but where are you on the journey? Are you on the way up? Have you been flat? Are you on the way down? All of this matters. And when? What type of time frame are you giving yourself to achieve these goals? These are very, very important as you're thinking about your health-related goals. Step number two in the framework is, do you have the right provider? This might sound silly, but like you debate this all the time in other areas of your life. Do I have the right financial planner? Are my kids in the right school? Am I currently in the right neighborhood? Do I have the right job? Am I mapping the right academics? We're constantly debating whether what we're doing is in our best interest and ultimately going to map us to our goals. We can't guess at this, and we don't guess at things that are important in our lives. Your health is your most important asset. This is the reason you need the right provider. Are your values and goals aligned? I think that's the most important thing. You might be super fortunate and already be completely connected with your provider, and if that's you, that's amazing. Count yourself very blessed, because most people don't feel connected and they don't feel like their voice is being heard, and their values and goals just aren't aligned. And when you don't have aligned values and goals, you have friction. And this is not a relationship that should be rooted in friction. I've already mentioned that the right provider should be your trusted advisor to your most important asset that you have, which is your health. Some would debate it's your time, and time is certainly one of the most important things because we don't get any more of it. But I would debate that time without health is not all that valuable. You've got to have your health. And if you have the right provider, they can help you identify what your goals should be. Sometimes we have deluded thinking if we don't have the right insight to actually know what we should be pursuing. We scale a mountain only to get to the top of the mountain and say, I actually need to be over there. I don't need to be here. So the right provider will help you identify your goals, and the right provider will help you create number three. And number three is the plan, which to me is the core of the executive level type annual physical. It's all about the strategy. It's all about the plan. It's the action steps. It's the contingencies. It's the proactive nature. It's taking all things into account and devising a plan with follow-up and measuring and documenting. Are we mapping our successes? Are we eliminating things that are easy to eliminate so that we can keep moving our goals down the road? The plan should help you prioritize your goals. In other words, everything can't be important. When everything is important, that means nothing is important. You've got to keep the main thing that's always been said. You've got to find your goals, prioritize the most important goals. And when I look at prioritizing goals for folks, I have a primary singular focus of eliminating surprises. So is there anything on the horizon that can take you out of the game that we are unaware of? I have a dear friend of mine who I lost just a couple of weeks ago in his late 40s. Massive aneurysm. Completely avoidable. Had you done a little bit of strategic thinking and planning with some imaging, that probably has been there for a long time. We could have identified that and fixed it. Is there a prostate cancer that we don't know about? Is there a valve that is not working? Is there an aneurysm in your heart that we don't know about? These are types of things that we need to be actively hunting for. And so as I'm prioritizing, I'm looking to eliminate any surprises. And then once we've got some clear margin that there's nothing immediately threatening your livelihood, we look for the most impactful goals first. So in other words, what one thing can you do that has a non-linear response? In other words, you don't do one thing and one thing happens. You do one thing and 17 things happen. Those are the types of goals that are very impactful because they create momentum, they create shifts, and those shifts create even more momentum, which help you to achieve even greater goals and greater achievement. Listen, I hope this video has been helpful for you. In the next video, video 2, part 2 of a 3-part series, I'm going to be digging into all of the labs and diagnostics that you need to be looking at in order to continue with these executive level type physicals. Take care, guys.